Cardiovascular stents are vital medical devices used to treat coronary artery disease and restore blood flow through narrowed or blocked arteries. The accurate and controlled crimping and dilation of these stents are critical steps in ensuring their safe and effective deployment within the human vascular system. We created detailed finite element models within LS Dyna to simulate the stent crimping and dilation processes. In this model, our focus is on 5 key areas: material modeling, process simulation, optimization, validation and calibration, safety and efficacy assessment. LS Dyna can develop comprehensive material models for stent materials to capture their behavior under varying conditions, including mechanical properties, temperature, and deformation characteristics. We can utilize LS Dyna simulations to optimize the crimping and dilation techniques, ensuring minimal stent stress, precise placement within the artery, and optimal post-implantation vessel patency. LS Dyna can validate the simulation results by comparing them to experimental data from physical tests and refining and calibrating the LS Dyna models to ensure their accuracy and reliability. It will also evaluate the safety and efficacy of the optimized techniques by assessing potential complications, for example, arterial injury, stent recoil, and compare the clinical outcomes with conventional methods. The successful execution of this model using LS Dyna offers substantial implications like enhanced patient safety, cost efficiency, and medical advancement. Optimized stent crimping and dilation techniques can reduce complications during and after stent implantation, leading to improved patient safety and recovery. Streamlined deployment methods could result in shorter procedure times, more efficient resource utilization, and a decreased necessity for repeated interventions, ultimately resulting in cost savings for healthcare systems. In conclusion, this model contributes to advancing medical technology and innovation in interventional cardiology, benefiting both patients and healthcare providers. Get connected with us to know more.